Hello, I'm Tyler. In today's episode, it's all about Tourette's and what more we can learn about those who have the condition. First off, Tourette's is a disorder in which a person makes sudden, unwanted brief movements, as well as sounds. When a tic is about to occur, the urge feels like an itch or a sneeze. When the tic transpires, a quick sense of relief is felt. The tics occur frequently. They are extremely uncomfortable and almost impossible to resist. The DSM-5 has classified Tourette's as a neurodevelopmental disorder. It is also seen as a spectrum disorder, since some people have mild Tourette's and others display a more severe case. Let's talk about the people with mild Tourette's. They experience tics that are barely noticeable, and usually they are controllable. Blinking and swallowing are some of the mild tics someone with Tourette's may experience. On the other hand, there are people with a more severe case of Tourette's. Their tics can affect their everyday lives. Uncontrollable jerks and muscle movements can sometimes prohibit the completion of everyday tasks, along with the physical tics. Many people with severe Tourette's experience verbal tics as well. Random words are shouted out, and this 100% affects the ability for these people to feel comfortable in public, and it is very difficult for them to maintain relationships with others. Whether the person has mild or severe Tourette's, it is still really hard to resist the tics.
17-year-old Billie Eilish is currently heating up the music charts. She is the youngest woman to top the chart since 2009. One thing many people may not know is that Billie has been living with mild Tourette's syndrome since she was a child. Eilish doesn't have verbal tics, just physical tics, like small jerks and other involuntary muscle movements. She recently opened up about having this disorder to her 24 million Instagram followers to address released videos of her tics from an unedited interview. She can normally control her tics when she is on camera, but in the pre-taped interview she let out her tics while they were asking the questions, thinking they would edit them out. Billie said she doesn't want the disorder to be something people think about when they think of her. She also expressed how grateful she was that her tic attacks haven't been a lot worse.
Riley Hawkins is a teen who has a more severe case of Tourette's. After developing the symptoms at age 15, the diagnosis took over a year experiencing both motor and verbal tics. The cause of this condition is still unknown, but throughout this struggle she continues to stay positive and help make a difference while trying to change people's perspective on this disability. She decided to create a YouTube channel known as Tourette's Teen, now with over 200,000 subscribers. In her videos, she strives to be more open about her disorder and make people comfortable with that topic. She also attended a camp with her mother and spoke publicly, telling her story and aiming to normalize this condition. She explained how it was triggered just before her 16th birthday, and it was quick for her. She first started experiencing motor tics, such as involuntary head jerks. After getting a CTC scan, vocal tics began to arise, such as swearing. As it became more severe, she decided to take treatment to help with her tics. She has seen medical professionals, both neurologists and psychiatrists, for the treatment and explains that her tics are constantly changing. At first, her condition prevented her from going out and it held her back, but she now has a new approach to life, making it easier for her to be herself and stay positive.
Tourette's doesn't really have a main cause, but genetics can be a major factor. People whose parents have Tourette's are much more likely to inherit this disorder. Men are also 3 times more likely to be diagnosed with it compared to women. The main diagnosis is monitoring the involuntary verbal or motor tics. Usually, the disorder is recognized between the ages 6 through 10, but sometimes it will not show up until later in life. People with Tourette's are also more likely to develop obsessive-compulsive disorder, OCD, and attention deficit hyperactivity disorder, ADHD. Scientists are still attempting to figure out what happens in the brain before and during the tics. It is found that there is activity in many different areas, including the basal ganglia and the frontal lobe. The basal ganglia is mainly for voluntary movements, and the frontal lobe is responsible for impulse control. These 2 areas are the most affected in people who have Tourette's. Many people believe Tourette's has a cure, but that is a common misconception. People who have the disorder have to live with the tics. Some lessen as they age, or can be reduced with treatment. For people trying to deal with the tics at a young age, there is a treatment called habitat reversal therapy. This helps children recognize the specific urge before the tic occurs, then form a new habit to replace the tic that is less noticeable. For those with severe Tourette's, a treatment option could be Botox injections. This causes the neurons to reject messages, therefore relaxing the muscles, causing them not to uncontrollably twitch. The only downside to this treatment is that it has to be done frequently to keep it effective. This is because the Botox wears off after a few months. The tics for severe Tourette's can also be diminished through medications such as anti-dopaminergic. Dopamine is a chemical that neurons can use to initiate movements in muscles. This medication works against the dopamine in your body, furthering the prevention of random muscle movements that occur during a tic. Thank you for tuning into this video. We hope you learned something important about Tourette's and have a new understanding about this disorder.